Thousands of protesters who marched through Cornwall at the weekend over health cuts are considering taking their campaign to London. They're angry that St Michael's Hospital in Hayle could be closed. The Royal Cornwall Hospitals Trust is facing a projected overspend of some £31 million. Well, Spotlight's Eleanor Parkinson is at the Trust's headquarters now. Eleanor.
Yes, feelings are running high over this proposed closure. Now, thousands of people have used St Michael's Hospital over the years, and local people say they don't want to lose the facility. The people of West Cornwall turned out in force this weekend to fight for their two local hospitals. The Trust, which runs them, has proposed closing one of them, St Michael's Hospital, altogether to help redress a massive projected overspend of £31 million. 27,000 people took to the streets of Hayle. Many say the closure of St Michael's is short-sighted.
It's vital to have a hospital like West Cornwall that can do accident and emergency, and it's vital to have hospitals like St Michael's that have a wonderful record of health, no MRSA, for example.
These marchers were joined by some staff from the Royal Cornwall Hospital in Truro, some of whom also stand to lose their jobs because of the huge debt. Many are clerical workers. The Trust are looking at contracting out their work to agencies overseas.
I think people were genuinely angry. I've never seen a bigger march in Cornwall. I think it was from the whole of Cornwall, it wasn't just from the west. And I think this sends a huge message out, not only to the Trust, but obviously to the County Council, to the Overview and Scrutiny Committee, who are responsible for monitoring all this.
The Royal Cornwall Hospitals Trust, however, deny there's a definite plan to close St Michael's. They say they're looking at a review of all services west of Truro, which may result in a new health park. So where has it come from that there is a proposed closure of St Michael's? Because I've seen paperwork and other people have seen paperwork, and they're pretty sure this site's going to be closed.
Well, I wrote the paperwork, so I know what's on the paperwork. It's one option. If you ask the question, how many hospital sites do we need across the county, we think we probably need 2 or 3. Something in the east, something in the west, something in the centre. So in the future, one can imagine the Penwith Health Campus replacing St Michael's and West Cornwall, and both sites shutting.
Meanwhile, the several hundred staff who've been told they may lose their jobs here at the Royal Cornwall Hospital in Truro are being balloted on possible strike action. The results of this ballot are expected next week. Well, joining me now is Marna Blundy from West Cornwall Health Watch. I mean, the Trust have already said this march won't make a difference.
Well, they would say that, wouldn't they? They said that 4 years ago when we had a march, but of course it does make a difference. And I'd want to say to each one of those people who walked, everyone's important and everyone's footsteps on Sunday will make a difference. One way or another, they can be assured of that.
The Trust also say that this proposed closure is not definitely going to happen. Maybe yes. A whole review of services down there, maybe something which will benefit the area.
Well, certainly. We know that it's not definite yet, or they've said it's not definite, but what we do know is that there are going to be substantive changes, both at West Cornwall Hospital and St Michael's Hospital, and those cuts are going to hurt patients. They're going to hurt people, they're going to hurt the staff who are trying to deliver a quality service. And I would point out that the march wasn't just about St Michael's, of course. It was a county march, and it's a county issue. We're wanting fair funding for the county. We're wanting fair management, not mismanagement. We're wanting not centralisation, but having services keeping them local.
Where do you take your campaign now?
It goes straight to the door of the County Council. We've been calling for months now for an independent review of healthcare and hospital services in this county. The County Council know that. The Overview and Scrutiny Committee will be meeting again next month, and those elected representatives really do have to take notice of all those thousands of people who marched. They put them there and they've got to do the job now.
Thank you, Marna Blundy from West Cornwall Health Watch. From Truro, back to the studio.
Well, thank you, and thank you for the scores of emails on this story. Many of you had some very strong views on the subject. I find the arrogance of the health authority official who stated that the march in Hayle would make no difference to the eventual outcome nauseating. For the benefit of this and future generations, this is a fight we cannot and will not lose, says Kevin Tull.
On the same point, our Trevor Harris says, how dare these incompetent people responsible for a massive deficit over the years be so arrogant in overlooking their own pathetic mismanagement, which has given rise to this fiasco.
And Maggie Parker, thanks for emailing. You said, incensed to hear the Trust response to the march. It just shows how little they understand the feelings of people in Penwith and around.
And Bill Raisin asks, is this another fat cat situation where executives are rewarded for failure? The public are paying for this through taxation. They deserve better.